Hi, I'm Bryn Blaze with the Career Conversations, and today I'm interviewing.
Hi, my name is Jamie Sayre, and I am a staff hospital pharmacist.
Awesome. And to start off our conversation, how would you describe your high school self in about 3 to 5 words or more if you'd like?
So this was one of the hardest questions that you asked, actually. I did come up with a couple. I thought that the words that describe me most would be motivated, curious, and responsible.
Okay. All right. Do you feel like those qualities kind of reflect either who you are today or how you carry yourself in your profession?
Yeah, I think it what helped me a lot in pharmacy school, being curious. There's a lot of science involved with pharmacy, so always being curious and wanting to learn is really important. Also, being responsible. We have you know, people's lives in our hands a little bit every day. So being responsible, organized, I think they're really important for being a pharmacist.
That's awesome. Thank you. Could you share your journey on how you ended up where you are today?
Yeah, so I when I was in high school, I wasn't sure what I wanted to be. I knew I really liked the healthcare field, but wasn't quite sure where I wanted to go with that. So I um, honestly, my mom, one of her close friends is a pharmacist. So she said, why don't you shadow her? Maybe you like to be a pharmacist. So I did, and I absolutely loved it. So I learned more about it. I did a couple more shadows. Um, I really liked that it was a job in healthcare, but then I didn't have to. Um, any pharmacist will say this, they don't like bodily fluids. So this is an awesome job if you like healthcare, you like helping people, but you don't like touching people or their bodily fluids.
It's a
So
little cheat code.
um, that's cheat code. So then I did a couple more shadows in high school. I found some colleges that have pharmacy programs. I visited those colleges, fell in love with Wilkes University in Pennsylvania. So I chose there, interviewed there. Then I did 2 years of undergrad there, 4 years of pharmacy school. Then I graduated, and now I work at Robert Pecker Hospital in Sayre, Pennsylvania.
That's awesome. So you mentioned you went to college, and I'm sure with all the insane names and factors that go into your job, what certifications and education do you have to get?
So to be a pharmacist, it's usually at the minimum, it'll be 2 years of undergrad
Okay.
and 4 years of graduate school. Some pharmacists like me do a what we call a guaranteed seat program. So I went to Wilkes knowing that I would get my degree in 6 years, and it is a doctorate of pharmacy. Some of my friends in my class did 8. So they went and got a bachelor's in a science related field, as long as they met all the prerequisites and they did it in 8. Um, so mine was 6. And then once you're a pharmacist, none of this is required, but there's options for residencies and fellowships very similar to doctors or other healthcare professionals. And there's also board certifications similar to doctors. So I have a friend with a board certification in oncology. I'm working toward my board certification in pharmacotherapy. And then there's also different types of like licenses you can get. Like I am vaccine licensed, so I can administer vaccines. So there's all kinds of things you can add on, but the basics are the 2 years of undergrad and the 4 years of graduate school.
Awesome. And to be in this field, people have to get some type of schooling slash certification.
Yes.
Yeah.
So it is required to be a doctor of pharmacy if you want to be a pharmacist. There's tons of other ways you can be in the pharmaceutical field without being a pharmacist. We have
Mhm.
amazing technicians, and that's a high school diploma with
Okay.
the opportunity to get certified. They have their own certification. Usually, techs who really like the job and want to stay in it work toward their certification. Um, and then you could work in research and other things with bachelor's degrees in like pharmaceutical research and things like that.
That's awesome. Okay. So what does your day-to-day look like, including like hours and whatnot?
So hours vary very widely depending on your position. So, like I said before, I'm a staff pharmacist at a hospital. So we are open 24/7. So mostly I'm 7 7:30 to 3 or 3:30, which is a really nice schedule.
Mhm.
But to be fair to, everyone, we do work some weekends, holidays, and evening shifts. It's not too much, in my opinion, but we do have those shifts. So in the hospital, the basics of what we do day to day, we get any medication in the hospital that the doctor puts an order in for
Mhm.
will come to us. We will look at it. We're looking for drug interactions, dosing, indications sometimes. So, what are they ordering it for, and does that make sense for this patient?
Yeah.
We look if they're all kinds of things, if they're allergic, if they have um, kidney dysfunction, all these kinds of things. We
Yeah.
look at them. And then once we click verify, then the doctor can get, or the nurse can pull the medication, or we send them the medication. So we're verifying all those orders. Our technicians are amazing. We couldn't do our jobs without them. They prepare the medications usually,
Okay.
grabbing the medication or filling the cabinets on the floor so that the nurses have closer access to the medication. We verify all that. A huge part of our job is answering questions and helping doctors make place the orders as well. So
Yeah.
sometimes they need help and we do that. We answer questions like, hey, what do you think we should do? What should the dose be? Can you
Mhm.
help me? So that's a big part of our job. And then also checking IV mixtures and compounding. So a lot of our techs mix the IVs, but we're making sure the components are proper, the
Gotcha.
measurements, everything like that are correct. And then we send the IV medications. We also compound suspensions, enemas, different things like that. Um,
Mhm.
and then recently I started covering and training in our infusion oncology center. So
Mhm.
that's very similar. We do check all the orders and then prepare the IVs for our outpatient infusion patients.
Oh, that's really cool.
Yeah.
Awesome. So, you mentioned earlier that if you don't like bodily fluids, but you still want to be in the health industry, this is definitely a route you can take. So, this role is kind of more behind the scenes rather than working with the patients directly, right?
Yep. So my day to day as a staff pharmacist is
Mhm.
behind the scenes in the main pharmacy,
Gotcha.
which is I love it. It's very rewarding, but
Yeah.
sometimes I do wish that I could be on the floors a little bit. So
Mhm.
in certain hospitals, pharmacists are out on the floor closer to the patients, rounding with the doctors. We do have a
Okay.
couple of those pharmacists, and hopefully someday I'll get experience in that as well. But my job as of right now is mostly behind the scenes.
That's really cool. Huh. There's so many different variants that you don't even think about. You just
Yeah.
kind of think of pharmacy as a whole, but then there's all these different components. That's awesome. Okay. And what type of collaboration do you do? Whether it be with like the doctors or other pharmacists?
Honestly, we do a lot of collaborating, communicating. So we collaborate, like I said before, like with doctors if they
Yeah.
have questions, different things that they want to, do you have this? Can we order this? What do you think? All those kinds of questions. We directly talk to doctors quite often. We also talk to nurses and patient care partners,
Hmm.
making sure like they receive the medication. We have a
Yeah.
pneumatic tube like at the bank.
Hmm.
So we tube them their medications. We communicate a lot like, do you want to come pick this up? We can send it, things like that. We nurses have a lot of amazing questions too, like safety wise.
Yeah. Yeah.
Can I run this medication with this medication or are they incompatible? Different things like that. So we answer a lot of nursing questions as well,
I see.
related. Everybody's double checking each other. It's really awesome. And, everybody catches different things because that's what their focus is. So
Yeah.
it's really awesome to collaborate. And then other pharmacists, I think every single day I ask other pharmacists like 100 questions. We talk about like, hey, what do you think? Like this is a little bit different than I usually see.
Hmm.
What do you think? You have more especially with a pharmacist with more experience.
Yeah.
So it's really nice just to have like all these people together that are really just trying to help the patient and everybody works together and it's really awesome.
That's so cool. I love that. Okay. With technology developing in this day and age, do you see your line of work going into any telemedicine or artificial intelligence being incorporated in your work?
So this is a really good question. So in terms of telehealth, we're already kind of doing it.
Okay.
We have a realm of pharmacy that we call ambulatory care, which is very
Okay.
similar to you going to the doctor and
Mhm.
having a doctor as an appointment. We have pharmacists that you can go see. So you would go to the doctor, get diagnosed with whatever condition. They would write you a prescription, and then your follow-up might be with a pharmacist to talk about
Gotcha.
the dose and how you're feeling, and maybe we should adjust. So from there, you can meet with a pharmacist. So one of my rotations in my last year of school is actually calling patients, like a little telehealth type, seeing how they
Oh,
were doing and having the potential to adjust their dose or help them get through some side effects was really cool. So we are in the telehealth realm just a little bit.
mhm.
We haven't quite gotten into AI yet, but I
Yeah.
think that there is a place for it. I don't think it'll ever replace us or our technicians, but I think it could be a really great tool. Um, to use. So far, I've kind of seen it as an opportunity to um, collect. So, a big part of being a pharmacist is looking at research.
Yeah.
So, I've seen AI, people use it to kind of get a big picture idea or like summarize a lot of research that would take you a very long time to get through
Yes.
and give you like a point from there to go off of. And I
Mhm.
think that's really awesome because it kind of cuts down on that research time, but gives you the resources. And then we take that and dig into it more or then come to our own conclusion about how to move forward. So rather than using it to like give us all the answers, we're kind of using it to consider all of our options and then make a decision from there. So I think it definitely has a place with us, and I think I'm excited to see where we're gonna go with it.
Yeah. The capabilities of it have been insane just looking at what it can do. In going along with this, job security, do you feel like there's a lot of opportunities in this field? Or
Yes, way more than I ever thought, to be honest. We're kind of a little bit everywhere from
okay.
veterinary to, like I said, the ambulatory care. There's hospital, there's independent pharmacies. So someone owns a pharmacy. There's our big chains, CVS, Rite Aid, mail order, which
Mhm.
is specialty with your more expensive medications. There's just so many options out there.
Yeah.
Working for pharmaceutical companies. So I
Mhm.
think that no matter if you're interested in pharmacy, there's just so many jobs that I never thought of. And right now, we're kind of in a huge staffing shortage, especially at my hospital. I'm not sure about others, but I've heard it from a lot of people that we need more pharmacists. So I think
Yeah.
that job security, I've always felt like I would definitely have a place out there somewhere.
Somewhere. Okay. That's awesome. Yeah, I talked with a couple other career fields where they're like job security is a little iffy, especially with the ever-growing artificial intelligence could be taking over their jobs. So this is amazing to hear for those who want to go into this career field. Okay, what do you find most rewarding about your job and then later challenging?
So most rewarding, I would say I just helping people.
Mhm.
I know that's kind of like a basic answer, um, but I there's nothing better, I don't think, for me than the feeling of like a doctor saying, "Thank you so much for helping me." Like I said before, we don't quite see the patient payoff from what we're doing, but we get so much appreciation from doctors and nurses. And I just know that like eventually it makes it to the patient and they might not even know where they're helping, but
Yeah,
just knowing that they're gonna go home and be healthier, that that is like a very rewarding thing to me that every day I'm making a difference, even if it's very small or only to a couple people.
yeah.
I would say that. Um, challenging. In terms of like personally or like career, like as
Either
a whole
way, either
field.
way.
Um, I would say as a field right now, like we talked about staffing shortage,
Mhm.
just the challenging personally to me, I would say is this is a really good question. Drug costs and reimbursement. I don't want to get into
Mhm.
it too much, but like
Yeah,
everybody knows, I think that like when you go to the pharmacy and they say your medication's $400, that's so frustrating. And
yeah.
we are so frustrated about it too.
Mhm.
So I think that like reimbursement rates dropping from insurance companies, so we're not getting paid quite as much.
Hmm.
And the patient, helping the patient find like an affordable medication that is reasonable for them that they can take that will help them, but
Yeah.
also can afford, can be very frustrating.
Hmm.
Um, and then just sometimes, like, I wouldn't say this is personal to like my hospital because I think we're pretty great.
Hmm.
But just knowing what we can do and that we're here to help
Yeah.
can be a little bit of a, I don't even want to say like, it's like a barrier. So
Yeah.
just when I like explain to my family what I do, they're like, no way. I thought pharmacists were like in CVS and they just handed me my medication. So just people understanding what we can do, how much we can help,
Yeah.
here to help has been a little bit of a barrier, but I think personally my hospital does a pretty great job. We get lots of calls all day long of like, can you help me? Can you help me? And I
Oh,
honestly, that's what I love because
yeah.
I'd rather you ask and we can help you. So I would say those are some challenges that as a whole like career field that we face.
Yeah. That's that's awesome. Thank you so much for that. Um, what advice would you give to a high school student wanting to come into this career field?
I would say shadow. It was such a big impact on me to shadow, research the different kinds of career fields and try to find, use your guidance counselor. My guidance counselor was amazing. She got me like three different shadows, I think, in high school, so that when I went to apply, I knew that this was really what I want to do. I've heard
Yeah.
the flip side from friends. I shadowed and I could not stand doing that all day. I'd be so bored or I didn't like it or and they thought that like that's what they wanted to do.
Yeah.
Like they were convinced. But then they spent a day in the life of that job and they were like, "No, that's not what I thought it was." So I think it's just really important to do your research, check things out, do a lot of shadowing, ask your family and friends like, "Hey, can I go to work with you a day? See what you
Yeah.
do." And I think that it's more impactful to see it rather than to read about it sometimes. But using resources to like research and see what different things are out there is really important too.
That's awesome. Thank you so much. And I have just one more question for you. Do you have any non-academic resources that you use to help you in your career? It could be like audiobooks, podcasts, other books, websites.
That helped me like at work.
Like it could be either how you get through the day or like what helps you perform your job better. Maybe
So
that's not the right
personally,
words, but
so personally to like decompress, I do read a lot.
okay, okay.
And do a lot of, you know, reading and relaxing. But at work, personally, if you want to be a pharmacist, your whole life you spend learning. You know, every day there's new drugs that come out and you know, we're changing the way that we treat conditions that have been around for years, but now they're like, oh, well, maybe this works better or things like that. So I do use a ton of resources at work as well. Just trying to keep up on the literature in easier ways. So there's tons
Yeah,
of websites and like email like lists that you can get on that like send you that stuff summarized. And so I would say that I do a lot of like work reading and non-work reading every day.
I
Um,
see.
so I use a lot of the resources that like work provided just to learn that kind of stuff as well.
So I believe that is all I have for you today. Is there anything else you'd like to add?
I don't think so. I think
Okay.
that covered most of it.
Yeah. Well, thank you so much for joining us.
Thank you for having me.
Of course. All
And
right.
if anyone, oh, sorry,
Go ahead, go
if
ahead.
anyone ever wants to reach out, wants more information or anything like that, you can always pass along my email or my
Yeah,
phone number to ask questions or anything.
awesome. Thank you so much again for joining us.
Thank
This will conclude the Career Conversation podcast.